Both those who are watching us live. I know there are a number of folks who plan on watching the recording of this webinar, and so welcome to you as well. That's, I guess, serves as a warning that we are recording these for future use, and so that people can benefit by them at their own convenience, and not everyone can make a 10 a.m. Thursday time frame, and so it's good we can have some flexibility with the recording. So please be advised that that is the case. Secondly, want to just reiterate that if you have questions along the way, you can use the hand waving feature. We'll use that as our kind of hand raise for a question or comment, and Justin is keeping his eye on that, and we'll use that as a way of feel free to interrupt along the way, and we can pause and take a question. Otherwise, you're welcome to hang on to those till the end, and we can address them then. So let me introduce myself. My name is Alan Mua, and I am the current chair of the Washington Alliance for Quality Recovery Residences, and have been kind of a founding member of that group since really 2016, 2017, when we really got rolling. And I'll talk a little bit more about WAQRR here in a minute, but my co-pilot today is Justin Cram. Justin is our WAQRR's first employee, and so Justin is our staff member and works on these professional development things, as well as the accreditation process that we're going to be talking about today. So so Justin is kind of at the controls, doing the behind the scenes work today, so appreciate that. So as I said, WAQRR started almost 4 years ago now, with a group of people who got together in a Seattle hotel and talked about the possibility of forming an alliance. And we had several purposes in mind when we did that. One was, of course, to have a group, a group of people who we could call in a pinch, or when we needed advice, or there was no existing network of people who do what we do. And in fact, at the time, we just didn't even know who all was out there doing this. And so, as you all know, there are a lot of different shapes and sizes of recovery residences, people with different missions, and but all kind of unified around the purpose of walking alongside people in recovery, giving them a safe and healthy place to live while they do what we know is a real difficult work. And so, again, a lot of ways that could look, and we have done and will continue to do other sessions on levels of care and what that looks like. But essentially, regardless of kind of the level of care, the kinds of services that each provider had, we thought that it would also be good to gather around the idea of quality standards. So how do you know when you see a listing of a recovery house or a recovery residence or a sober home? Can be called a lot of different things. How do you know that it's a good idea to refer somebody to that place? And so we very early on decided, instead of just having a directory of homes that we knew about, that directory should include homes who have been vetted in some way. So so that when we make a referral, or when even an agency uses our list to refer somebody to housing, that they can feel confident that somebody has taken a look at what's happening on the ground at that location, and has really done some investigation into how things are working there. And so again, really early on, we decided we wanted to pursue some sort of process by which somebody would need to be vetted before they made it onto our list. So we connected with the National Alliance for Recovery Residences, or NAR, and the NAR folks had been working for a number of years on a standard, a nationally recognized standard that at that point, I think they were in version 1.5, maybe closer to 2.0. and so we adopted that a few months later as our standard with a couple modifications that were state specific. And then this last summer, 2019, we adopted version 3.0 that NAR released, and really had made some good modifications to theirs. And interestingly, when they modified that standard, the modifications that we had made that were state specific went away because they had changed some things to match what we were already doing in our process. So we started our accreditation process about a year and a half ago, maybe 2 years ago now. We really dove in full bore and really made that available. And actually, when I say we full bore, it wasn't quite that way. We actually rolled it out a little bit and tried it on a few sort of guinea pig providers, ourselves included. And really wanted to be sure we had a process that we could feel good about and as we open it up to other people. So we did that, and we've been accrediting ever since. We now are accrediting, I lost count, but somewhere around between 25 and 30 homes. And we are in conversation with a few other providers that will bring our total up over 40 pretty easily once they're done. And so there's a number of folks in process at present. So I wanted to just talk a bit about why you might want to pursue accreditation to begin with, and what the value of that is. And we just thought of a few benefits that we thought would be worth sharing with everybody. But the first one is just the credibility in our communities. And so personally, when we have been approached by our municipality or a neighbor or somebody else who had concerns about us opening up in their area, being able to say that we are accredited by somebody, that somebody is looking at us annually and paying attention to the quality of what we're doing, and that we are obligated to follow a set standard and adhere to that. That really boosts the credibility that we've had in those contexts. So just being able to tell people in our local communities that that we're part of something bigger, and not that we are a part of another organization. WAQRR has no desire to be in charge of a bunch of residences. All we're doing is we're putting forth a standard that says no matter what your shape or size or what your organization looks like, if you're providing recovery housing, there's a set of standards that you should be able to adhere to that would just ensure that you're treating people well, and that you're running your organization and your individual residences well and according to best practices in the field. So the next thing is just documented accountability, and that's a similar kind of concept that there's actually documentation that you've been through some process. So we're going to talk about our 3-phase process, but throughout that there are lists and check marks and essentially some scoring that happens, which we'll talk about, that basically says that once that we're voluntarily saying we want to be under the accountability of somebody who knows the field and who knows what they're talking about, that they've looked us over and they've said that we're doing things according to best practice. And if the final documentation takes the shape of a certificate that we issue that is valid for a year for each provider. The next thing is that there is an increasing amount of funding and even other kind of informational resources and so on that is available to accredited providers. So the way that works is that we in WAQRR will walk somebody through our process in order to list them on our accredited provider list. And then the state of Washington, the healthcare authority, is in the process finalizing right now their registry, which was created as a result of House Bill 1528, which passed last year's legislative session, essentially requiring the state to have a registry. So the state has contracted with us to do that accreditation process, and essentially electronically they on a regular basis pull their list from our list. So all of that, getting back to funding resource, that there are a number of municipalities, there are a number of state programs, and we believe a number will continue to that number will continue to grow. That will require being listed on those registries in order to have access. So at present, we're an example. New Earth Recovery, which is the nonprofit housing organization that we run up here in Skagit County, we have a current state contract that helps us operate 2 of our 5 homes. The county is a financial partner in that. In order to be eligible for that contract that we had to apply, we had to show documentation of WAQRR accreditation. And so Snohomish County is doing a similar thing, and a King County Drug Court is also doing that and moving toward requiring that. They are impressed by our accreditation and want to be able to move in that direction. And so there's funding, other resources. By that I mean just being a part of the group of accredited providers will give us access to really first access to resources that come up. There is a loan fund we're just in the process of finalizing at present that was also a part of the legislation that I talked about. That loan fund will be accessible by WAQRR accredited organizations as well. And again, they're just now working out the ins and outs, but that loan fund will essentially be for the purpose of giving somebody startup capital. So it's certainly not going to be in the realm of where somebody could go purchase a home and use that money for down payment or a significant part of a purchase. It really is instead designed to provide maybe first and last month rent, some furnishings, that kind of thing. So if you need to, if you're ready to go, you've got policies in place, you know what you want to do, but you need just a head start financially in order to kind of do those upfront costs. That's what this kind of loan is there for. And then there's a repayment schedule back to the state. So the actual detail of all of that is still forthcoming. And so as soon as that is out, we'll be announcing that via our website and our newsletter. So keep your eyes open. Again, there's a meeting coincidentally happening on that today that I hope will establish some of those things, and we'll be able to start putting the word out shortly. So resources available to people who are funded. The next one is we really believe the idea of networking is powerful. So even in our short lifespan, we've gotten together when that was possible. We've gotten together physically on a few occasions, and we've always taken the opportunity, regardless of our topic of conversation or the training subject, we've always taken the last part of the day and just opened it up and asked people, what kind of questions do we have for each other? How, what kind of things are you dealing with that you'd like your input on? And those are always very rich conversations, and some typical subjects recur, but they're always interesting variations on themes. And so just being, again, a part of a network where you can pick up the phone or come to something and learn from a colleague is really important. And then referrals. This might need to be, should have been at the top of the list, but essentially by being on our registry and on the state registry, those will be listed on the web, and most of us don't have a problem with demand. In other words, there are a lot of people looking for recovery housing. However, as funding increases for recovery housing, what we're finding is that there are more and more voucher type programs that are available. And so when somebody is referred through a voucher supported program, then they come with some funding. And again, often that funding is going to be tied to accreditation or listing on the state registry. By 2023, if a state agency, or if an agency is state funded, they are going to need to, they're going to only be able to refer to people on the registry. So this is a really important part of the legislation that passed that we're really trying to educate people about, to say, if you're wanting to get referrals from treatment centers, other state-funded agencies, you're going to need to be on that list. So just a heads up, and we're working toward accrediting as many folks as we can ahead of 2023, so that we're ahead of the game and everybody's kind of in the fold already. And then ongoing professional development. So like this, we have a full series of webinars that we're doing this year, as well as hopefully, if and when we're able to gather in person, a couple all-day just sort of recovery housing 101 gatherings. We have a couple gatherings slated to talk about licensing and what that looks like for folks who want to kind of take the next step in a higher level of care. So there's a lot of topics to talk about and cover that we really are excited about. The other thing that is in development, and we're not there yet, but we want to do what our colleagues in other states have done, which is create academies. So a place where a housing provider can send house managers to learn how the sort of the ins and outs of being a house manager, and again, forming a coalition of those folks, a network that they can call and get support from one another as well, we feel like is going to be really important. That does not exist today, but it's in our plan to create that opportunity for people who are on the ground in houses, who just need a level of support and some just basic kind of training in some areas, that just some competencies that we feel like would be helpful for all house managers to know, regardless again of the shape or size of their organization. So let's look at the process itself. And again, if you have questions or comments, you're free to interrupt along the way, or we can handle those at the end. But our process essentially has three components. So the first one is an online application, and that is available there at recoveryhousingwa.org, or you can get to it through the WAQRR website, which is just waqrr.org. And so that's sort of the first contact, is to start that application. You can start that at any time. You can stop at any time and click save and exit. And as long as you hang on to your login information, you can go back in. And so we always tell people that it's going to take a bit to do the application. I'd say in terms of what takes the most time to prepare for in the process, it really is this application piece that we're going to ask for a number of things to be submitted, which we'll talk about. So we created it really kind of easy in and out. You can sort of chip away at it a bit at a time and go gather information and come back to that application. The next thing is the group interview. And so at each interview, we gather a group of folks who come together. We'll talk about that a little bit, what that means and who will be present at that conversation. And then finally, we do a site visit. So one or two folks who have been trained to do this will come and visit your facilities. If a house is going to earn their accreditation status, we need to see it. We're going to walk through every room. And what we're looking for, of course, is some really basic things around health and safety. We mirror our process by the HUD list, if you're familiar with what that looks like. But there's essentially a checklist that when they do HUD inspections, they work from. And so we try to be in line with that as best we can, just as a best practice. Our folks aren't housing inspectors, and so they're not. There are a few codes that we pay attention to that seem like they're kind of the biggest health and safety kinds of things, but we're not there to say that somebody's place should pass some sort of municipal inspection. That's not what we're about. We're just looking at the health and safety of residents. So 3 steps. So the first one is, the first one is the interview, but I want to talk about for a second is the WAQRR quality standard. So before you even dive into the application, we recommend that you take a look at the quality standard. It's again at waqrr.org on our website. This document you can look at, and it basically, it's a little bit intimidating at first till you get kind of read it. And if you're if you're doing good work and you're paying attention to residents, most of this stuff is already happening. What we found when we went through the process is that we just had to do a lot of documenting of these things. So we treat people fairly financially, but we didn't have policies written down about how we handle refunds and what kind of information we give residents upfront before they move in or before they sign any kind of contract or agreement with us. Some of those kinds of things. So there's a lot to the standards, essentially in 4 areas. You can see here: administrative and operational domain. 13 standards there. That's just, we want to see that you have, that you're licensed appropriately for what you're trying to do. And we don't mean like a Department of Health license, but a business license, that you have as an entity, gone through the process of, you're listed as a nonprofit corporation. If you're a charity that receives funding for what you do, that you're registered with the Secretary of State Charities Office, those kinds of things. So we're looking to see that you have insurance that covers you in case of a catastrophe or something happens, that you've got some liability insurance, and that if you have a board of directors, that those folks are covered. And so, so we're just looking at some basic business practices. And again, we're not attorneys. We're not trying to do that or give legal advice, but there are some things that we're looking for that need to be in place that will help you ultimately when other people come to question your legitimacy as an organization. So that's the administrative quadrant. The second one is physical environment. So this really is health and safety kind of stuff. 5 standards there that just talk about what the environment should look like. And the real emphasis there, of course, is around health and safety, but beyond that is that these are homes, right? So we're looking for a place that looks like a home that you would live. So if if it's a double loaded corridor and it looks like a hospital or an institution, that may or may not meet the standard depending on what other things are going on that make it sort of home-like. And so, how do you define a home? Well, you kind of know it when you see it. There's some pictures on the wall. Maybe there's just a sense of people, of comfortable places to be. Not everything is regimented and sterilized. That there's some just some hallmarks of a home-like environment. So anyway, if you look at this, you look through the standard, you'll kind of get a sense. I think this was NAR's best attempt to kind of quantify that as best they could. Domain number 3 is recovery support. So what separates us from as a recovery housing provider from any other kind of housing provider? What's different? What's the difference between recovery housing and, say, permanent supportive housing? And we believe that permanent supportive housing is great, but that's not exactly what we do. We provide a different kind of housing that supports people who have decided that they want to go down a recovery road, and that abstinence is a part of that. And by the way, the definition of abstinence is complex and worth talking about. And that's one of those topics that we would cover in a longer kind of time together. But what does it mean to be a place that is encouraging people in their journey towards long-term recovery? So 10 standards there. So you can tell that NAR and we care a lot about the environment of a place, that it feels like it is supporting people in their recovery. And then 4th is good neighbor. So this is on here because we really, we can't exist without some sort of local support. We certainly have the right to exist by law in some ways, but we want to have more behind us than just the Fair Housing Act or other legislation that kind of protects our existence. We want to be good neighbors. We want to fit into neighborhoods and be considered an asset to our community. And so we're very interested in being sure that some things are in place that ensure that, to the best of each provider's ability, that they can do that. So again, ahead of sort of starting the application, we really want to encourage you to spend some time with the standard. So what we've done then in the accreditation process is say, okay, how are we going to get at and see how a provider is meeting each of those standards? And if you add that up You'll see there are a number of them, and we want to be sure that they that is the best of our ability through our process. We're kind of validating that a provider is meeting all of those standards. So again, that document is available on our website. The next document that's available there is our Code of Ethics, and we're not going to read through all of these. This is probably a separate webinar in and of itself, but I am going to just flash them on the screen to give you the chance to read. These are things that we believe, and again, this comes from NAR, but we've adopted it here in Washington to say that if you're doing a good, responsible job as a housing provider, these are things that are in place for you, regardless of the shape, size, or character of what you're doing on the ground. These are things. So there's the first set. I'll give you a second to glance at the next one. I'm tempted to start articulating and explaining each of these, but I'm going to resist that temptation. I'll just let you read. And again, you can find this on our website, and we will actually, as a part of the process, require that all staff and we call them sort of engaged volunteers who are working directly with residents in any kind of significant capacity, that they sign off on this, and that we actually see their signatures on a scanned copy. And then here's the last set. All right, so that's the Code of Ethics. So you can see this is it's a good list, and some of these may bear some explaining. And so if you want to hang on to any questions you have about what any of those mean, or I guess maybe I'll just break now for a second and give anyone an opportunity. I'm also glad to go back a slide or two if anyone would like. So please just let Justin know via chat if you want to have any kind of or if anything comes up about any of these. I'm glad to pause here and talk about them. And Justin, I'll give you a few seconds pause and then you can let me know to move on if you're not hearing anything, which is fine.
No raised hands and no comments just yet. So
okay, well then let's keep moving and we can come back to these. But anyway, so those two documents, the standards and the Code of Ethics, are kind of fundamental, and the process is sort of based on them in large part. So the first piece again is the online application, and I'm just going to highlight one or two pieces of that. Again, you can find that at either of these two websites. We just happen to own both of those domain names, and one of them will take you to the other. So, but the application has a few sections. The first one's pretty easy. So you're going to talk about each house. So if you are a provider that just has one house, this is going to be pretty easy. Your house and your organization information is going to be largely the same. But you know, anything you want to say about your house, what it looks like. And this is stuff that will actually be published on our directory. So, and we try to be really clear on the application to say which information is published and then which is private, just for us to know about. So you're going to describe the house, and that includes things like what do you want people who are reading the directory to know about finances, costs. You don't have to you can articulate anything you want here, but it's an opportunity to kind of put your best foot forward and say, here's what we offer, and here's our philosophy, our mission statement, those kinds of things. And then organization, if it's broader than just one home, you might have a variety of residences, but this is where contact information, all of that kind of stuff is going to be listed. So you're going to talk a bit about who you are as a provider, as opposed to just sort of nuts and bolts about the house. So required sign-offs. By that, we actually ask a series of questions in there that just affirm that, that once you're accredited, that you'll stay connected to WAQRR and that you'll participate in our events and our activities. We are hoping very soon to be doing some helpful data collection, which probably should be a separate bullet on here, but we hope that we'll start tracking some outcomes, some resident outcomes that we'll be able to sort of collate, put all together, and be able to use that as evidence base for even funding and more support from government and private entities. And so if we gather that statewide and even combine that with national data, we feel really good about what we can say about the value of recovery housing. And so once that's in place, we're going to ask all of our providers to participate. So this is just basically saying that that by applying, that you're willing to be a part of that process. And also, like I said, we're going to ask that everyone has signed off on the code of ethics and etc. And then document submission. This is the part I want to talk a little bit about, because in terms of what's going to take the most time in the application process, this is the one. And so as we go forward here we go. So this is kind of what that looks like in the application. I'm just showing you, and this isn't to intimidate anybody. If you look on the right-hand side, you'll see everything that we require. And this isn't a complete list. This is just a snapshot of the page, but you sort of take a look at the things that we require. This is just a sample. I just pulled up one organization's documents and so on. So you may have a document that you've uploaded on the left that's something like resident agreement and rules or something, or resident guidelines. And your resident guidelines might have 5, 6, 7 of these required policies that are listed on the right. And so all you're going to do literally is you're going to take your cursor and you're going to click on one of these on the right, and you're going to drag it over underneath the document on the left. So what that helps us do when we're going through the process is be able to say, okay, if we're looking for proof of insurance, we're going to find that here, and that might be its own, likely going to be its own separate document. But you can upload as many documents as you need to on the left here, and then on the right, you're going to just show us where we can find each of these. In order to click the final submit button at the bottom of your application, all of these on the left or on the right need to be checked off. That means that all of them are spoken for in some document here on the left. So we try to create a system that's really user-friendly, but that is checklisty, but that also kind of has some teeth in it, so that we know that once you've clicked submit on your final application, that you've actually really gathered all of the information you need. So here's some good news with this, is that we've created a document sort of repository, or repository of sample documents. And that is available by request from us. And so once you sort of start your creating policies, working on your documents and so on, you can just ask us, hey, can I see the samples? And then we'll send you a link to this directory where you're going to be able to look to see. And these are all samples from folks who have been accredited by us. And you'll see a wide variety. So again, we're not trying to dictate what a lot of these policies need to look like, but they do need to be articulated. So we're not super interested in what your refund policy is, but we do want to know that you have one and that you've communicated it really clearly to your residents ahead of time, so that they know exactly what to expect and that you're sort of ethically operating in that way. So we will read to be sure that these policies exist. If there's any kind of rub between a particular policy and maybe one of the standards, we would certainly talk to you about that. But anyway, wanted to show you this piece of the application just so you saw what that kind of looks like. So I'll pause there again to see if anyone has any questions about documents. This is just a snapshot. The list on the right is a little longer than this. It's a few lines down. And another thing I'll say is that when you mouse over, when you sort of put your cursor on one of these and you're on the live website, it'll give you a little explanation of what it's about. And again, as soon as you start the process, you'll be connected with us, and we're happy to answer any questions along the way or provide sample language, that kind of thing. More than happy to be a part of that. I think I should have said this at the outset, but our goal is that you succeed in this process. So this is not a gotcha process. This is a lot of, there's some checklists and so on that we hope will be really helpful for you in putting this together. So any hands up, any questions so far on this stuff?
There are not any so far.
Okay. All right, well, we're going to keep moving along then. So the next part then, so again, once you're done with the documents, you've pretty much done the application piece. Somebody from WAQRR then will be back in touch with you and may have some questions, may have a suggestion or two about tightening up a document or something, or if something's not clear. And this is really a collaborative process that we really like to go through with our providers. And so, and I'll tell you, ahead of the process, we knew that we were doing good work, that we were treating residents well, that we were providing a good quality environment for folks. But we had to do some work in this piece where we had to really articulate what we were doing, and we had to come up with some policy language that we were going to follow. And that process was really rich and good for us. So just an encouragement along the way that this isn't just, our goal isn't just that you jump through hoops to meet our requirements, but that this is a really good kind of quality building experience for your organization that really gets you to think about some things that are important. And so the next step, as I said, is the interview. And the interview is to get to know you as a provider and get to know kind of what things look like on the ground. So there are some things that are just hard to discern from a set of policy documents. So we can't really tell what it looks like. So we're going to ask questions about, okay, when a resident first walks into your place, what do they get in the way of orientation? And we really like to hear just from the provider kind of how they do that process and what it looks like on the ground. So I think it probably goes without saying here that this is something that will happen after someone's up and running for a bit. So you can show us a bunch of policies before you open your doors, but this piece would be really hard to do until you've actually had some experience running your home. So this becomes really, this is largely sort of experiential. So again, we're trying to get at maybe a little bit of philosophy here. Again, not to make any kind of judgment about philosophy, but looking for the overall kind of concept that this is a recovery residence and that there's some hallmarks of supporting residents in their recovery in the process.
And Alan, just real quick, we did have Megan say, is it okay if several of these are all in one document or packet in regards to the standards that we were?
Absolutely, yeah. So again, you can put as many into one document as you want. I think we had one provider that has that sent us 2 documents. One of them was just a PDF of some scans of some insurance info and a bunch of businessy kind of stuff. And then the other one was I think their resident agreement that had all of their resident policies in it. So yeah, it is likely that you're going to have more than one required piece in a particular document. So, but again, as many documents as you need to upload, there's space for that. So we can add as many as you need to. All right. So that's the purpose of the interview. The interview team then, why it's a group interview is we have 1 or 2 folks from WAQRR leadership. And sometimes we'll have somebody even from the healthcare authority that's sitting in, as there are kind of state partners in this whole process, and they are involved with us. And so there might be somebody from there. And then there is also going to be another provider, and obviously a number of us that are connected to WAQRR are also providers. So we have 2 hats, but we also invite providers who are in the process themselves. So as you enter this process for yourself, we are going to invite you to be a part of somebody else's accreditation process. So the goal there, obviously the not so secret goal there, is that you get a chance to see what somebody else is doing. So you get to experience the value of our network just from the get-go, where you're going to see how somebody else is doing it. And just a little inside insight is that every time I do one of these interviews, I leave saying, hey, I think we do better than those guys in this particular area. But I also leave saying, hey, I think we've got something to learn from them in terms of something that they're doing that's really innovative, or that really just takes recovery support to a whole nother level. So it's a humbling experience. It's really good. And the goal is, again, to provide you with just a rich, so that the accreditation experience itself is a learning experience for you. And so, so as you enter in, submit an application, you'll likely be asked to sit in on somebody else's interview, and you will likely interview somebody else before you were interviewed yourself. So again, these aren't a bunch of secret gotcha questions. They're just things that we feel like speak directly to the standards. And we want to hear what people have to say, and we want to share that information as broadly as we can with other providers, so we can really learn from each other. So that's how that team works. So this is just a little insight into what we do then, how we evaluate. We kind of have a little red light, green light kind of scoring system. So if a question, a group of people who are evaluating the interview feel like, wow, that they're doing great in that category. We don't have much feedback to offer. We're just really, they're right on target with the standard and beyond. They'll get a green. A yellow means that that the standard is being met. It's not so we're not in any kind of danger zone here, but there might be a way to improve things. So here's just a suggestion that we'll leave. We're not requiring that you do anything differently, but something to think about to maybe improve what you're already doing on the ground. And then a red would mean that we would let a provider know that we're asking you to do something different here. And not because of just we think you should do better, but because there's a standard in question, and we'll almost always identify the standard and say, well, the standard says that you need to provide this, or that residents need to be treated this particular way, or policy needs to address this. I'll give you an example or two. We've had a provider who said that, boy, we weren't able to, we don't meet, our residents don't meet regularly. Like, they get together and talk about things, but there wasn't anything that was an identifiable gathering. And we felt like there are a number of standards that speak to what it takes to have community in a house. And we felt like a regularly scheduled house meeting of residents really needs to be in place in order for that kind of important stuff to happen. So we required that they identify a meeting time and place, and that their residents met regularly. So that's just one example I could think of. But so there might be other kind of things like that again kind of come up in those conversations that we think, boy, we really need to be sure that they meet that standard. So we will, after the interview, generate a report back to the provider that says, okay, here's some things we want to commend you on that look great. Here are some suggestions that we have for areas that you might want to think about. And then here are some things that if you want to continue in the accreditation process, that we need you to address. And that's essentially the feedback that they get. Once those things have been addressed, and there's some documentation of that from the provider, which generally is a pretty quick thing. It's usually something that says, yes, we're going to do that, and here's what it's going to look like. We have yet to have a provider that sort of cross their arms and say, nope, it's not going to happen, because we think that what we're suggesting is reasonable. so that's been so far so good on that score. But who knows, maybe somebody in this group will be the first to say, nope, we're not doing that. And anyway, hope not. So the last couple things here, of course, on health and safety, so this is things like fire extinguishers. There are codes that are universal codes around smoke detectors and carbon monoxide detectors, and so and all of that is easily found. We send it to people ahead of time, so again, there's no gotcha here. And then we're looking at environment. So we actually talk to your residents, and so we're looking for residents to be home, a few of them anyway, and the site visitor will sit down without the provider present, and just spend a few minutes just asking them essentially questions like, what's life like here? And how's it been? And what kind of, do you get some recovery support? Those kinds of things. So really wanting to hear from residents what it's like to live in the home. And there are some very specific standards that we're looking for there. Again, just like on all of our, we try to be really intentional about what we're looking at. But and again, this isn't a gotcha experience. It really is conversational, and our site visitors are nice people. So I just wanted to give you just a couple examples. We send this checklist ahead of time. So again, there's no secrets here, what we're looking for, but just examples. We're looking for that a house integrates into a neighborhood, that it looks good, that the lawn's being mowed, and that things are, that it's not an eyesore. We really want, ideally we want to be one of the nicest homes in the neighborhood, not because it's rich or fancy looking, but because it's just very well kept. We want to be good neighbors. So we're looking for condition of obviously roofs and that paint and porches, all those kinds of things, that they're sturdy and in good condition, inside and out. We do a little bit on electrical safety. We want to be sure that the right kinds of outlets are installed where they're supposed to be. That's life and death kind of stuff. There's aren't exposed wires and that kind of stuff. And again, this is all on the list. Appliances are functioning and in good shape. You know, we look at things like our water heaters strapped in like they're supposed to be according to code, and so on. Sanitation. So we looked at there are covered trash cans in kitchens and stuff. So and that surfaces are clean, and there's a mechanism for cleaning surfaces, those kinds of things. So maybe a little more than what you'd look at a single family home, but not much more. The idea is we're just trying to be sure that there's some safety things in place that you would want to have in place when there's a group of people living together. And then the interview piece with residents is getting at recovery support primarily. So when you live here, what kind of support are you getting, and are you getting help where you feel like you need it in order to sustain your recovery? Before I do this next piece, any questions about the site visit or the interview for that matter? Anything that you're wondering about what that would be like? All right, I'm moving on, but feel free to interrupt me, Justin, if something pops up for anybody. Everyone always asks, well, how long is this going to take? And I think most of the time is taken ahead of time. So when you get a look at the application and you see the documents that you need to have in place, the policy documents and so on, that's where the time is really going to be put in. You might also spend some time when you get the site visit checklist, kind of going through to be sure that the facility is up to speed, and that things in the facility are in good shape. So if you're already doing a lot of that and things really are in good shape, that won't take you very long to prepare for. But we generally try to return, once an application is turned in and documents, we generally try to do the document review in 1 to 2 weeks. And that, of course, once we're done with that, we may have some feedback or some questions. So we might go back and forth a little bit with you on just being sure that everything is represented, and if we don't understand something or if there's some sort of conflict with the standard, we'd want to work through that. But generally we can do that pretty quickly, again, by phone or email if something needs to be sent our way. Interview is not, this isn't a day-long deal. It's 1.5 to 2 hours long, and we're doing that via phone or video conference. So as always, some of the hardest part of that is just scheduling it where it works on everybody's calendar, but we take that on ourselves to do. And then the site visit, and that's 2 to 3 hours per residence is what we found works. So we're going to walk through every room. We're going to test a lot of electrical outlets. We're going to just kind of get a sense of what the place is, just kind of be as thorough as we can. And then of course we're talking to residents at each house as well. So that takes a few minutes as well. So that we tell people to generally plan on that. And if you have a number of houses kind of all together and some of the things are the same in each, it might go a little faster, but that's a typical time frame. So when you sort of add all that together, we find that most of the time from start to finish, once documents are submitted the first time, we're looking at probably about a month. And that's everything kind of moves along, and we get back to each other in fairly short order and resolve things. Our goal isn't to drag this out. And then I should have also added on here that that process then is an annual process. The front end is a little bit modified when we come back because we've seen your documents, and if nothing much has changed, we don't spend a lot of time in document review. We'll still do an interview, and we'll still do a site visit, but again, that might not be as extensive if we're looking at the facility that we've seen before. So, so that is, in a nutshell, our process. And I guess I'd want to open it up, and if people have questions about any of that, would love to take a couple minutes and answer them. Anything come up for anybody? I think I mentioned I know a couple of you are in process of getting ready to open, and so this is a little bit down the road for you. We want you to be kind of up and running a little bit before you dive in to accreditation process. So I'm going to go back here, turn on my camera just so I can at least be a little bit more personal here. But Justin, any questions or comments from anybody?
So far, Karen just said, thanks for making this so streamlined, not so scary now.
Good.
No questions yet.
All right. Great. Give another few seconds. Justin, anything you can think of that I didn't talk about that's worth mentioning, or any questions that you have that came up for you that you're wondering about that we can chat about while people are thinking?
I don't think I have too many questions that came up. It was pretty thorough. Just wanted to comment basically saying, you know, there is moments where people do submit the documents and we just have to be like, hey, you know, we have this whole entire list. We're just missing one or two things, and I don't want that to seem like an intimidating process. Like, we're just hoping to just get those last things, make sure that everything is meeting all those standards. And the faster we're able to do that, the faster we can move on with the process.
Right.
Yeah.
Yeah, that's great. All right, well, I don't want to take any more time than is necessary here. We, as always, we're available by phone and email to as you're ready to dive into this. And for those of you watching the recording, of course, always happy to field questions that way as well. So thank you so much for joining. We have another webinar coming up in October, which we'll be promoting soon. And we also, as I mentioned, will have more information coming out shortly about the loan process for those of you who might be interested in that. And our other professional development opportunities as we get closer. We do have some things scheduled for in-person opportunities. Those will happen one way or the other. So if we can't do them in person, we'll convert them over to Zoom and just take on the topic with a panel kind of format, or we'll do something kind of creative via Zoom. But our hope is eventually, maybe by somewhere around the new year, to be able to start doing some gatherings. I guess we'll play that by ear. It's beyond our control, but we certainly appreciate you joining us today and look forward to seeing you in the future. Thanks so much, everyone, and take care.